Nice to meet you. My name is Hisatoshi Ishikura of Cellforce 1 Clinic. After graduating from the University of Tokyo School of Medicine, I worked as an orthopedic surgeon in the Department of Orthopedic Surgery at the University of Tokyo and gained experience in a variety of medical institutions. I specialize in hip joint surgery and I have a postgraduate degree in research on synovial membrane of joints. At our clinic, I am utilizing my experience as an orthopedic surgeon to treat patients in the field of regenerative medicine. We offer state-of-the-art regenerative medicine using adipose-derived stem cells and have treated 163 cases so far. I am a board-certified plastic surgeon by the Japanese and International Plastic Surgery Associations and have published numerous papers both in Japan and abroad, and am constantly striving to acquire the latest medical knowledge. At our clinic, we will carefully diagnose each patient's condition and propose the most appropriate treatment. We will make the most of the potential of regenerative medicine to reduce pain and improve function. The clinic is located in Ginza 6 Chome, right in the middle of Ginza. We are located right in front of Ginza 6, in a building next to Uniqlo. Our prime location ensures easy access for all our patients. Regenerative medicine is an innovative medical technology that utilizes the body's natural healing abilities to repair damaged tissues and organs and restore function. The therapy uses specific biomaterials called stem cells and regenerative factors. First, let us introduce the central element of regenerative medicine: stem cells. Stem cells are specialized cells that can transform into many different types of cells in the body. For example, they have the ability to change into various tissues such as bones, muscles, skin, and nerves. Regenerative medicine is expected to use these stem cells to promote the regeneration of damaged tissues, but the effects may vary depending on the patient's condition. The stem cell treatment process involves first harvesting fat cells from the patient's own body, which are then cultured and grown under specific conditions. The stem cells are then transplanted to the damaged area, where they are expected to transform into the tissue of that area and promote repair and regeneration. However, the effectiveness of stem cell therapy varies from patient to patient, and not all cases will have the same results. Next, let me discuss regenerative factors. Regenerative factors, or stem cells, are proteins and molecules that the body naturally produces to promote cell growth and repair. In regenerative medicine, stem cells are being artificially introduced to enhance the ability of tissues to repair themselves. However, the effectiveness of stem cell-based therapies may also vary depending on the patient's condition and the type of therapy. One of the advantages of regenerative medicine is its potential to promote healing through a natural process as compared to surgical procedures or drug therapy. Because it utilizes the patient's own cells and components, it is generally considered to have a low risk of side effects and rejection, but all treatments carry risks. Decisions regarding the effectiveness and risks of treatment must be tailored to the individual patient's condition. Regenerative medicine offers new treatment possibilities, especially for chronic diseases and intractable injuries, but it does not work for all patients. For example, individual outcomes for joint damage, heart disease, diabetic foot ulcers, and other conditions can be cured by enhancing the body's natural healing powers, but individual outcomes will vary. While regenerative medicine technology is still evolving and new treatment methods for many more diseases and injuries are expected to be developed in the future, currently available treatments are limited and not all technologies are actually used in the medical field. If you are interested, please consult with your physician first for more information. We strive to provide regenerative medicine that is appropriate for each individual patient, utilizing the latest technology and knowledge. Our doctors will explain the indications and risks of the treatment in detail, so please feel free to consult with us. Hello, I am Dr. Ishikura, the doctor in charge at Cellforce 1 Clinic. I would like to explain about the regenerative medicine we provide at our clinic. Cellforce 1 Clinic is a medical institution accredited by the Ministry of Health, Labor and Welfare as a Type 2 regenerative medicine institution. With this accreditation, the clinic is well positioned to provide regenerative medicine safely and appropriately. Among regenerative medicine, we focus on the treatment of chronic pain and arthritis. In particular, we provide treatment using stem cells and regenerative factors to patients suffering from knee arthritis and other joint diseases, aiming to alleviate symptoms and improve quality of life. Regenerative medicine uses the patient's own cells to promote the repair of damaged tissue. At our clinic, fat cells are harvested from the patient's body, cultured and grown under specific conditions, and then applied to the joint or area to be treated. This process is expected to result in natural tissue repair and regeneration, but the effectiveness of the treatment will vary depending on the patient's condition. Importantly, as a medical institution accredited by the Ministry of Health, Labor and Welfare, our clinic provides treatment with the highest priority on safety. However, please understand that the effectiveness of regenerative medicine varies from patient to patient, and we cannot guarantee its effectiveness. The effectiveness and prognosis of the treatment will be explained to you individually after your consultation. While we offer the possibility of regenerative medicine to those considering treatment for chronic pain and knee arthritis, it is important to have a thorough consultation before undergoing treatment. Our physicians will evaluate the patient's condition in detail and recommend the most appropriate treatment. Cellforce One Clinic aims to provide safe and effective treatment using the latest regenerative medicine technology. If you are interested in our services, please contact us for a consultation. I am Dr. Ishikura, the doctor in charge at Cellforce One Clinic. In this video, I will explain our unique treatment policy and process of regenerative medicine at our clinic. Our regenerative medicine uses the patient's own cells to repair damaged tissue and restore function. Our policy emphasizes keeping the harvested cells refrigerated, not frozen, and returning them to the body while maintaining a high cell viability rate. With this policy, we aim to minimize cell damage and maximize treatment potential. However, treatment results will vary depending on the patient's condition. First, a consultation with the patient is conducted to ensure that regenerative medicine is an appropriate treatment option. An infectious disease check will be performed by drawing blood to confirm that the patient is free of HIV, hepatitis B and C, and other infectious diseases. These tests are strictly confidential and the patient's privacy is strictly protected. After the infection checks are cleared, stem cells are harvested from the patient's fat cells. We have the technology to culture stem cells even from a small amount of fat tissue, and the process is carried out under thorough quality control at a culture facility approved by the Ministry of Health, Labor and Welfare. Stem cells are stored under refrigerated conditions and cultured for several weeks. Our process aims to minimize cell damage and maintain a high survival rate. However, treatment results will vary depending on the individual patient's condition. Once cultured, stem cells are injected intravenously or directly into the affected area to promote regeneration of damaged tissue. The doctor will fully explain the benefits of the treatment in advance and provide detailed information about the risks and expected results. After treatment, regular follow-ups will be conducted to monitor the progress of the treatment. Additional treatments may be suggested if necessary. If you are interested in regenerative medicine, please feel free to contact us. Our doctors will provide you with appropriate advice.